Hey guys, so in this video we will be talking about the management of ectopic pregnancy. So ectopic pregnancy is essentially when the actual gestation is not within the uterus, it's outside the uterus. So common locations for this can include the ampulla, the fallopian tubes, and can include within the pelvic wall and the pelvic organs as well. So these are common locations for ectopic pregnancy. It is a surgical emergency and you have to catch it early, as if there is delay in diagnosing and treatment, it can be very detrimental to the patient. So the first step in evaluating a patient with ectopic pregnancy is to determine, is the patient vitally stable or not. If the patient is vitally stable, okay, you can move on to the next step. However, if they're not vitally stable, you have to take them to surgery. If the patient is stable, the next step is to evaluate, is the beta-HCG less than 5,000 and is there fetal cardiac activity? If the beta-HCG is less than 5,000 and there is fetal cardiac activity, you can move on to the next step. However, if the beta-HCG is above 5,000 and there is no fetal cardiac activity, you have to send the patient to surgery. If the answer is yes, your next step is to determine, is the patient a candidate for methotrexate? Now, methotrexate is an antifolate medication that can inhibit cell DNA synthesis, okay, and it can be used in conditions such as rheumatoid arthritis and ectopic pregnancy. Okay, with methotrexate, the assessment for for whether a patient is fit for methotrexate is the following: does the patient have any contraindications to methotrexate? Contraindications include immunodeficiency. So patients who are immunodeficient or immunocompromised, such as HIV patients. Does the patient have liver disease? Because methotrexate is metabolized by the liver, and a side effect of methotrexate is hepatotoxicity. So if a patient has liver disease and you give them methotrexate, it can acutely worsen their liver function. Another contraindication is renal disease as well, and pulmonary disease. Methotrexate can cause pulmonary fibrosis. Okay. Another contraindication is the patient currently breastfeeding, as methotrexate can be passed on through breast milk. And lastly, does the patient have thrombocytopenia, which is low levels of platelets? The normal platelet count is between 150,000 to 400,000 cells per millimeter cube. If it's less than 150,000, this is a potential contraindication to using methotrexate. If the patient is not a candidate for methotrexate, you send the patient to surgery. Okay? If the patient is, you start them on methotrexate. This is a quick evaluation of a patient with an ectopic pregnancy. So if the patient is vitally stable, you can move on to the next step. If not, send them to surgery. If the patient's beta-HCG is above 5,000 and there is no fetal cardiac activity, send the patient to surgery. If it's less than 5,000 and there is fetal cardiac activity, you assess, is this patient a candidate for methotrexate? Contraindications to methotrexate include immunodeficiency, liver disease, renal disease, pulmonary disease, breastfeeding, and thrombocytopenia. If the patient does not have any of these contraindications, you can give them methotrexate to eliminate the pregnancy.